I'm going to discuss Medicare Part B, so stay tuned. I'm Keith Armbrecht, founder of MedSup Savings. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So please, after this video, take just a few minutes to explore our Resource Center. You'll likely find everything that you need for Medicare. You can also get an immediate quote for your Medicare supplement insurance. Just fill out your basic information and it will provide the rates for the plans that are available in your area. It would also be a really good idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help.
Now we're going to talk about Medicare Part B and the benefits that go with Medicare Part B. So if you've already watched the video on Part A, you kind of understand how that works with the hospital. This is Part B, which covers things outside of the hospital. And if you like, when you're done, if you go to the Resource Center at MedSup Savings, you go to the guides and the forms, you can download this information that I'm about to show you, and you'll have it with you whenever you need it. So Medicare Part B, we need to understand it's optional. So you don't have to have Medicare Part B. If you choose to have it, and most people do, there is a $105 a month premium for Medicare Part B. So it covers things outside of the hospital. And a lot of times, if you're on a group health plan still with an employer, they require you to have Part B. So make sure you understand that. And if you need to have it, you make sure you get it. So the benefits that go along with it, there is an annual deductible of $147, and that is once a year. So it runs from January to January, not per service or per confinement or anything like that. $147 per year. Medical expenses, so things that happen outside of the hospital, it's an 80-20. So Medicare pays 80%, you're then responsible for 20%. So that's usually the reason that most people would have a Medicare supplement. And again, if you watch Part A, you understand what you're responsible for on Part A and Part B. Medicare supplements are what takes care of the out-of-pocket expense on your side. Lab services, generally 100%. So Medicare generally covers 100% of lab services. Home health care is 100% of an approved amount. So it's not always 100%, it's of the approved amount. And then durable medical equipment, if you need a wheelchair or crutches or something else that falls into durable medical equipment, it's again 80-20. Outpatient hospital treatments, a little bit gray. Medicare payment to hospital based on outpayment procedure payment rates. And then coinsurance is based on outpatient payment rates as well, which is generally the 20% that falls into the coinsurance side of things. So there's a reasonable amount of out-of-pocket exposure on Medicare Part B, which again is generally why you would have a Medicare supplement that would take care of those costs for you. Blood charges. So you're responsible for the first 3 pints and then 20% of any amount after that. Excess doctor charges. Very important to understand this. Excess doctor charges. Now, first understand doctors don't necessarily have to accept Medicare patients, so they may choose not to accept a Medicare patient. If they do accept Medicare patients, there's 2 ways that they can handle it. If they accept Medicare assignment, that means that they will bill Medicare and they will accept whatever Medicare reimburses for their services. If they only accept Medicare, they do not accept assignment, that means that they will accept you as a Medicare patient, but they have the ability to charge excess, which can be 15% more than what Medicare is going to reimburse. So they can accept the Medicare reimbursement and then bill you for an additional 15%. So you may want to, when you're making a doctor selection, ask them if they accept Medicare assignment. That means they will take whatever Medicare is going to reimburse. If they only take Medicare, then you may be responsible for 15% above that. And that may be okay. You may want to go to a doctor that charges a bit more but has, better wait times and better patient services and things of that nature. It's simply something to understand how it functions. So you can read a little bit of the small print down on the bottom, but pretty kind of easy to understand. And this is where Medicare supplement comes into play to cover the costs that would be out of pocket to you. And again, you can go right on my site at MedSup Savings. You can get an easy supplement quote that'll show the rates and the plans that are in your area. And again, you can download this information in the Resource Center as well. So if you have any questions, I'd be happy to help you, and I can certainly help you with a supplement plan. Feel free to give me a call, and I hope you have a great day.